Ladies and gentlemen, please welcome the Doctors of Paradox.
Before you've actually gotten them into the bed.
Yes.
Fascinating.
I want to be nice.
You want to be nice to anybody before they get into bed. Good evening. Greetings. We are Paradox. I'm Dr. Anthony Mayer. This is Dr. Christopher Guzan. We have founded the Paradoxical Institute of Improvised Medicine, the institution which we not only founded, but graduated from as well. Because modern medicine is anything but. Correct, Dr. Guzan?
Correct, that is absolutely correct. And in this room, with this show, what we are going to do is we are actually going to find a medical problem that doesn't exist yet. We're going to find it, we're going to diagnose it, and we are going to cure it throughout the course of this session. So we need some help with that.
This is ominous.
How much more of that can I do throughout this 20 minutes?
About two minutes more.
Excellent, all right. Take it away.
Yes, you're going to figure quote everything so that they don't know what I'm actually saying? I like this.
Go ahead.
Yes, for tonight's case study, we need someone to study. It's all right. We won't use your real name. Your identity will never be revealed except to everybody in this room. You will only be known as Patient X. CJ, will you find us a Patient X?
Yes, there's one. I saw one hand. This one guy. I knocked over the mic. Yes, bring your beer. Come on up, everyone. Get up. We'll make it work. Hello, Patient X. Now, we are going to ask you a series of questions, but before we do that, we actually need some help up here. So, let's get our IMPs up here. We call them IMPs. They actually stands for
Improvised Medical Practitioners.
Yes. So, can we please introduce our IMPs one at a time? First up, we have Michael. And then we have Michelle. Give it up for Ian. And last but not least, you already know him, Erik. So our imps are going to help us recreate some of the past, present, the future, anything that we can to get into the mind of this problem and solve it. But first, we need to ask questions. Dr. Mayer, do you have a question to ask?
Yes. Can you tell us what most concerns you about your current health status?
That's a loaded question.
No, it's a straightforward one. Yes, what concerns you most about your current health? Do you have any current concerns?
Yeah, my ED.
You heard it here first.
Notice.
I have a question for you. What are your aspirations? Do you have an aspiration that you wish, besides, curing the ED?
Another beer for my
Another
friends.
piece, and that's it? That's as far as it goes? Okay.
I want you to breathe in as deeply as you can and sing the first Beatles song that comes to your head.
No.
But I'm sure it was on one of the B-sides.
Fair enough.
What are your pet peeves, if you have one big one?
What is it? Laziness.
Laziness. That's a good one.
And yet he wants other people to get his beer for him.
That's true. What is something that really, really excites you? And this is aside from the ED.
Overtime hockey.
Overtime hockey. Ooh, yes, you know how to have a good time.
Where do you see yourself 5 years from now?
Telling you what to do.
He's dreaming big. And where were you 5 years ago?
Back in South Bend, Indiana.
South Bend, Indiana.
We've heard of it. What did you do there?
Not much.
Not much. Professionally? All right, so that's good. Dr. Mayer, any other questions?
I think we've gotten everything we need to start Patient X's case.
Excellent. IMPs, do you have what you require?
Yes.
Excellent. Perfect.
All right, let's go back and sit down. Thank you.
Everyone, Patient X! I hope you get another one. All right.
seen the surface, but let's probe a little deeper.
Yes, let's get into the mind of this problem, figure out what the problem is, diagnose it, and then cure it. Ladies and gentlemen, are you ready? Excellent. So, imps, are you ready?
Yeah!
Here we go, and begin.
No, it's fine. It happens to everybody sometimes. I'm already over it.
I'm really sorry, Michelle. That happened. It's never happened before. You know, in our 6 months of dating, I've always been able to take things into overtime, so to speak. And, well, I just want to thank you for being so understanding about it.
About that. I mean, it's just that finals are coming up, and I really got, I got it. So, I'm gonna have to.
You're stressed, I get it.
Yeah, I'm gonna have to get a handle on some of myself. So this is over. I just want to be clear.
All right.
No fucking, no friends.
Damn, dude, that's some cold shit.
Oh, no. She just said, she did it in the middle of a CVS, and I was like, what?
Wait, which aisle?
2.
Damn! Magazines and candy?
Magazines and candy. I reached over and I bought myself the latest edition of People magazine and looked at that all night. Take that as you will.
You know you were into reading.
I'm into reading.
Come here.
Sure. You know what? It's just so sad because every part of that relationship I dug it into overdrive. I put it into overtime.
Yeah, I know, man.
Put it into...
Okay, I can only set you up with one more of my friends. You
All right.
gotta stop leaning into it so much.
All right, I like to go fast, you know? I like to just get things done.
Right, yeah.
I like to do it fast.
Sure, yeah, but you have to understand that comes off as rather aggressive a lot of the time.
You know what? I feel what you're saying, and I hear you, and I want to not listen to you.
Give me one last chance, okay?
All right, what's her name?
Name's Tracy.
All right, I can work with that.
Okay, she's really nice.
Okay.
I'm Tracy. Nice to meet you.
All right.
What's your name?
Tristan.
Tristan. That's a nice name.
Yeah. Well, what's next?
Hey, Tracy.
Oh, I'm sorry. I'm sorry.
I'm her father!
I'm sorry. I just really take things.
I wanted to wish you luck!
So, sure, are we going somewhere else, or are we going to go back to your place, or what? You can come, I don't care.
Oh, you want me to get, okay.
Love you.
Alright. Okay, eating something too. Not just drinking.
It's a big part of the meal.
Good day.
Yeah, it wasn't too bad. I mean, it was just kind of one of those regular days. Oh, come on! That wasn't a penalty!
You'd think I'd be used to that. So, I thought we were gonna do our best to watch less hockey while we're eating dinner.
Well, yeah, but this has been going on since like noon, so. This is triple overtime. It happens like once in a lifetime.
Okay. Alright. So we'll just watch the game. It's 8 o'clock. Day off together.
Dad, it's 7:45. I need a ride to school.
Yeah, as soon as this game's done, son.
It's in septuple overtime. That's 7 periods worth of overtime. Can't you just take 5 minutes to drive me to school?
Nope, I can't even risk looking at you for more than 2 seconds.
Fascinating!
Fascinating!
Dr. Mayer.
Fascinating. What have you observed, Dr. Guzan?
I've observed quite a bit. First off, I must draw attention to the fact that there is a lot of pent-up erectile rage. The dysfunction
That's a
is
new way of
caused-
describing it.
Exactly, but the dysfunction has caused more of a dysfunction than just in his penile cavity. It has caused a dysfunction in his very mind.
So the problem started upstairs and worked its way downstairs, is what you're saying.
It may have happened the other way. Sometimes men think with their dongs.
I've never heard of that. That is a possibility. There's lots of unchecked aggression and a lot of obsession with outward signs of masculinity. I think it's something we need to look into deeper.
I think so.
Let the diagnostic continue.
Onward!
Onward!
You have what's called a penile cavity. Well, it can be fixed. But you're gonna have to stop sucking so much dick.
Here's the model, doctor.
You know, I can't help myself. I let it in and around my mouth.
I understand. When I was younger, I once had the same issue.
My dear, I don't know how to tell you this, but I've been your doctor for a long time, and I'm afraid that you have a very large penile cavity.
What does that even mean?
It means you have to stop sucking so much dick. What? It's a very clear diagnosis. It's been going on for years. I had a very similar condition when I was young.
Well, young man, we've just put your x-rays up on the big board, and we've taken the leeches off you, so your blood's fine. Penile cavity.
Oh, shucks, gosh, dog, what does that even mean?
You gotta stop putting penises in your mouth, my boy.
I love you so
You gotta keep the claw foaming inside you. It's like shouting into a canyon.
Well, what should I do, Doc?
Well, I don't know, because this has never happened to me.
So I know they're having some trouble with your masculinity. Just wanted to let you know that I'm here for you.
Thanks, Dad.
Honey, did you tell him you told him by yourself, didn't you?
I'm here to support you too, but your father and I, since we split, thought we'd do it together. Not this time.
You guys should not live together anymore.
Aren't you supposed to have it on Sundays?
Yeah, but I decided to be here for this big moment. I know this must be really serious for you.
What the fuck? Your parents got divorced and they still live together?
Yeah, and they still fuck. I don't really understand it.
That's so weird. And you still hear it really loudly?
Yeah. But I don't really mind. Don't judge me, okay? I'm going through a lot.
Okay?
I'm going through a lot.
I'm here for you. I'll
Okay.
listen, okay? It's just my face judges, not on the inside.
Well, maybe you should work on it a little harder because your face says, wow, you should not listen to your parents have sex anymore.
Weird man.
I'm sorry! Being 14 is hard, okay? It's hard, okay?
I'm
It's
14
hard.
too. I understand
Yeah, I know.
Things are happening to our bodies that we don't quite understand.
Plus, living in South Bend, Indiana is also just shitty.
So your parents have asked me to do a little bit of a diagnostic on you today, and it appears that you enjoy hearing them having sex, and it's creeping them out. So they want that solved. And
Okay, your face says you should not do that anymore, and I don't think I'm being appreciated as a patient, okay?
I think it's your parents that aren't appreciating it. I just want to get them
Fine.
All right, look, we've had a lot of news stories come out about your oral fixations.
Yeah.
I want to know, what is it that you like most about listening to your parents have sex? I want a new style for my next record.
Okay. Well, I guess I can always tell which hole it's in.
Okay.
Country.
Every country.
Hey, could you sign my record? Well, I guess it's your record.
You know what? It's fine. Yeah.
Do you think? Okay, I've got a picture of my mom, and here's a picture of my dad. You think you could draw it on there too?
Yes, I can. Oh, anything for a fan.
Well,
Anything
you
for
know,
a fan.
I'm glad there's someone out there that understands.
Hey, and if you ever want me to listen to you have sex, I'm totally down. Yes, anyone.
All right, I want to have a sample session with you and somebody having sex, all right? I'm going to go into the EDM business.
Okay, yeah, that's totally fine. So, yeah, well, I'm 14, so this is kind of weird.
That's fine, you can take as much time as you want, right?
So, like 4 years then?
Yeah, sure, 4 years. I mean, I'm going to have to buy a whole bunch of equipment, and, so you take your time, make yourself comfortable, whatever, but when you have sex, I want microphones on every single orifice. You understand?
What was that last word?
Wait, so you want me to do what? You want to have sex with me in 4 years?
In 4 years on this exact day, my birthday.
And you want to record it?
And I want to record it so that he can make a record of us having sex because he wants to do EDM music. I listened really good.
You want to pay me for it? Wait, doesn't that make me a prostitute?
Correct, a prostitute. You'd be a prostitute. But sorry.
Don't think of it as a prostitute, think of it as being a musician.
I feel like I'm too young to be in a room with you by myself.
Holy shit!
Dr. Guzan, eccentric British recording artist, do you think that might have been? My money's on David Bowie.
I think it was Sting.
We'll never know.
We'll never know.
But this does explain a lot. If your formative years are spent in as unhealthy an environment as that, you can't possibly grow up normal.
No! There's no choice! South Bend, Indiana is a toxic place!
Especially when British 80s recording stars invade.
I could see, however, that the age is a factor. It represents his immaturity. That immaturity that's trying to burst forth, but in a very freaky manner.
This is going to poison him for the rest of his life, isn't it? I shudder to think how it's going to affect his future.
Well, I think we're about to see.
I'll take you up on that. $10, we don't see it.
You're on. Onward! So, blind dating, huh? It's kind of weird, isn't it?
It really is uncomfortable.
Yeah. So, oh, thank you.
Thank you. Yeah, you wanna split a plate of nachos?
I love guacamole.
I eat guacamole, both of those.
Oh, good.
Great. Yeah. Hey, here's the guacamole.
Before I get those, is this going to be one check?
No, we can split it. Yeah.
Oh, it's that.
So who wants the guac? Who wants the nachos? Who wants the guac?
I'm not sure if I want anything anymore.
Okay, so just the nachos then?
Yeah, just the nachos.
Just the nachos. Got it.
Isn't the man supposed to take the check?
Well, yeah, I was gonna pay for the nachos anyway, but the extras and stuff, that, I mean, this is the first date, I don't wanna treat you too much.
It's just chips. It doesn't take any time.
Okay.
Just whatever happened to sugar, you know?
Whatever happened to paying your own way?
Well, I mean, I'm a broke college student, so. But I mean, I figure eventually I'll have enough money to make ends meet and stuff.
Good luck with that.
I guess I rely on a nice young man like you to show me a good time.
She was a prostitute?
Yeah, and she called me young.
Good for you!
I'm telling you, my 50s are gonna be great.
All right, I gotta get back to the university.
Okay. Well, it was nice that you stopped by.
I thought it was too.
Yeah.
I'm glad we got to catch up.
Yeah.
I'm just glad we don't have any unfinished business anymore.
No, you're right. Yeah.
We're on good terms now.
Yeah.
We were married, you watched too much fucking hockey. It's over.
No. Now you're running a university, and I'm pretending to be young in front of prostitutes.
Everything's so good.
Yeah, everything's exactly the way it's supposed to be.
So you're 29?
Yeah, sure, I'm 29.
Okay, listen, I don't think you're 29, and I'm definitely not gonna have sex with you if you're gonna lie to me. Okay, I'm all about honesty. I'm an honest prostitute.
You can't just call me after every I'm remarried. Kind of a big deal at Notre Dame.
Yeah.
So, I mean this in the nicest way possible. Lose my fucking number.
Dad, will you stop using my ID whenever you hire a prostitute? I've been detained by the police 17 times.
Here you go.
Thank you.
Won't happen
I
again.
appreciate that.
Yeah.
Still watching that hockey?
Yeah, the game still isn't over.
You should really, just make your own fucking nachos.
Haven't some of those players like retired or died?
Oh, yeah, no, they keep cleaning them off the ice. Yeah.
And sometimes I think the world's exactly as brutal as you always told me it was.
See, now you're actually starting to listen to me.
You know, I had to come around. It took me a while. You made my life hell.
I know, that was the whole point.
I don't follow your parenting technique.
I am the ghost of Wayne Gretzky. Turn off the fucking television!
You can make a comeback anytime, I'm waiting for you.
I am dead! Don't you see? Don't you see? Okay. Just stop watching hockey. Your son's pissed at you, and and you got a divorce for nothing besides hockey.
But hockey is all I've ever known. It's what makes me feel like a real man. You take that away, I got nothing left. There's nothing holding me up.
Trust me, I know hockey. There are other things besides hockey, young man. How old are you, like 18?
That's so nice of you to say.
Hey, don't listen to me! All right.
Man, that sounds real fucked up.
Yeah.
Hey, do you need a drink?
Yeah. Like a beer.
Can I see your ID?
Yeah. Oh shit, I gave it back to my son.
Breakthrough! There we go. Dr. Mayer,
Let's start with that.
I think we did solve this.
I've got a solution in mind, but I want to hear yours.
Hockey was the problem.
Hockey is a definite problem.
Yeah.
One of the problems. But I think hockey is just a cornerstone of the problem. He's built himself a whole false masculine identity.
True.
Based on acting more confident and more aggressive than he actually is.
A 43-year-old perpetually in a 29-year-old's body.
I call this Sylvester Stallone's disease.
Excellent. We made progress.
How would you treat this?
I would treat this by first, obviously, eliminating hockey,
Oh, it's the obvious.
and an hourly double dose of extends.
Hourly?
That's
Maybe.
48 doses in a day. You won't get to sleep. If they say it lasts more than 4 hours, go to the hospital. Well, he's going to be living there.
Just in awe of your new 48-hour day.
Thank you.
I recommend also that he started diet rich in soy and edamame. Natural testosterone decreases. Yes, pump fat estrogen. And you'll have a well-balanced member of society in no time.
Excellent. Imps, do you concur with this conclusion?
Yes.
Yes. Excellent.
Talking like that, and we'll give you your fake degrees in no time.
Yes.